Good morning, ladies and gentlemen. The Committee on General Government Operations, Appropriation, and Housing is now called to order. For the record, today is Wednesday, June 24th, and the time now is 9:12. Notice for this budget hearing was disseminated via email to all senators and all main media broadcasting outlets. Public notice was issued on Monday, first notice was issued on Monday, June 15. Second notice was on Monday, June 22nd. The committee will hear and accept testimonies on Bill 282-35, the Fiscal Year 2021 Appropriation Act as requested by the Governor relative to the Department of Public Health and Social Service Fiscal Year 2021 budget request. Joining me for this budget hearing is the Oversight Chair of Public Health and Social Services, Senator Therese Terlai. I'm also joined by Senator Regine Bisco-Lee, Senator Telo Taidagui, Senator Luis Muñoz, Senator Kelly Mars Taito, Senator Jim Moylan, and Senator Mary Camacho Torres. General rules for the budget hearing. The conduct of this budget hearing shall be as follows. Those testifying on behalf of the department will be recognized by myself, and they have been invited to the panel. Written testimonies shall be submitted to the committee. Please provide my legislative staff with your written testimony for photocopying. Testimonies may be read, and lengthy testimony should be summarized. Testimony shall be confined to the substance. My colleagues and the panel, please be reminded that we will be discussing the budget of FY 2021 and nothing else. We may ask a little bit of 2020, but not much. Individuals will be allowed to present oral testimony. Once you are done, you may be asked to remain in the room for questions or for additional testimony as may be desired by the members of the committee. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and/or may be asked to leave or be escorted and removed from the room. When you speak, please make sure that the microphone is on and that you speak into the microphone. You please state your name and title for the record. At this time, I ask the panel from the Department of Public Health and Social Service to rise and for our Sergeant at Arms to please swear them in. Thank you, Sergeant at Arms. I would remind my colleagues that this hearing will end before 11 o'clock because we do have another public hearing at 11 o'clock. So I'd ask my colleagues to please don't ask too many questions. You've got a copy of the slides. If there's anything else you need to know from Public Health, you can ask them separately. Other than that, Ms. DeNorsi, if you please begin with your testimony, presentation of your 2021 budget.
Thank you. Good morning, Senator Therese Terlai, senators of the 36th Guam Legislature. My name is Linda Ompinko DeNorsi, the Director of the Department of Public Health and Social Services. The Department of Public Health are my slides going to show up on the screen? Okay, so I'm ready if you can show it. Okay, thank you. We go to the next slide, please. The Department of Public Health and Social Services is comprised of 5 divisions. The Division of General Administration, Environmental Health, Public Health, Senior Citizens, and Public Welfare. Given the 5 divisions, I'm here today, of course, with my management team, but they're outside. That is comprised of our 2 deputy directors of the department, Lauren Duenas and Josephine O'Malley. They're sitting in the lobby. And I also have next to me our Public Health Administrative Services Officer, Mr. Tommy Taidagui. And of course, we have all the different divisions from my slideshow. And again, the other divisions are comprised of the Division of Public Health, Dr. Kay Kaneshiro, the Division Chief of the Environmental Health, which is Mr. Tom Nadeau, and the Acting Chief, right now we have Tess Archangel in the lobby, comprised of the Division of Public Welfare Chief. Next slide, please. The Department of Public Health and Social Services has a total funding of $85,082,106. And of this amount, you have $39,381,914 is a federal share. And 45,700,192 is the local share. Next slide, please. Thus, the Department of Public Health and Social Services is requesting 45,700,192. And of this amount, 34,638,347 is requested from the general fund, and 11,061,845 from the special fund. And when I say the special fund, that's inclusive of all our different revolving funds, comprised, as you can see on the screen, of environmental health, our Department of Public Health Sanitary Inspection Revolving Fund, the Office of Vital Statistics, our Health Professional Licensing Office Revolving Fund, and of course, this is in addition to the Healthy Futures Funds. Next slide, please. And as you can see on the screen, we have a total of 11,061,845. And the whole breakdown is going to be the total, as you can see, of each of the revolving fund of 1,935,522. The total Healthy Futures Funds breakdown of 9,126,323. And that's how we got the 11,061,845. Moving on to the next slide, please. Of the 1,935,525, as you can see to the farthest right, which is a total revolving fund, we have all the funds combined on the revolving. The Environmental Health Revolving Fund, as you can see way on the bottom, the grand total, that's all been itemized in order of the different object classes. We have a grand total on the Environmental Health Revolving Fund of 1,322,750. Moving on, the Department of Public Health's other revolving fund relative to the Division of Environmental Health is the Sanitary Inspection, which is comprised of 85,425. And then the Office of Vital Statistics is 241,442. And then the Office of Professional Licensing Office, 286,085, the grand total. And that's how we got the 1,935,522 for the total revolving fund. Next slide, please. I'm going to break it further down so that you can get an idea of the Healthy Futures Funds now. We group them according to the total for the general administration of the whole 9,126,323 from the Healthy Futures Funds. The breakdown are as follows. The general administration, we have the FMS Facilities Maintenance Healthy Futures Funds for a grand total of 264,768. Our supplies Healthy Futures Funds, which is 139,214. Our MSS is 735,036. And then our Facilities and Maintenance Healthy Futures Funds of 293,361. Thus, giving an overall General Administration Healthy Futures Fund grand total of 1,432,379. Next slide, please. We move now to the Division of Public Health. As you can see here, this is going to comprise all the Healthy Futures Funds from the various programs. The Project Carino, which is 458,537. Our CDC, that's the Communicable Disease Control Program, Healthy Futures Funds of 739,385. Our Health Professional Licensing Office, which is the total Healthy Futures Funds of 243,310. Our Chief Public Health Office of 1,106,199. And the total for the Bureau of Family Health and Nursing Services Healthy Futures Funds of 957,435. The Bureau of Primary Care Services, also known as the Community Health Centers, the Northern and Southern Region Communal Centers, Healthy Futures Funds of 2,284,337. And our Bureau of Community Health Services, Healthy Futures Funds totaling 76,727. And the medicine and vacant positions, this is specifically for the community health centers. This is the Healthy Futures Funds of 535,099. Thus, you get the overall total Public Health Division Healthy Futures Funds grand total of 6,401,029. The next is the Division of Environmental Health, which has everything itemized, as you can see. Next slide, please. All those are itemized in the various object classes amounting to 1,092,915. Realize that a bulk of this is really for personnel. As you can see on the screen, 922,018 is a total for the salaries and the benefits. And so the operations is minuscule, only at 170,897. And thus you have 1,092,915 as the grand total. And then after that, we have the 200,000, and that 200,000 is from the, can you please next slide? Yes. So as you can see on the screen, if we subtotal all the different Healthy Futures funds, which I've already explained to you all, it's 8,926,323. If we add the Healthy Futures fund for the cancer screening program, that's under the Division of Public Welfare, that's an additional 200,000, and that's under the miscellaneous object class. We have the grand total for our Healthy Futures funds of 9,126,323. Next slide, please. So if you look at the slide, there's going to be a series of 3 slides that you can see on the screen as we journey through. Next slide, please. And that will have all the different object classes. And then what we're going to do is we're going to look at all our special funds. That's inclusive of the environmental health, the everything from Division of Public Health, Environmental Health, Office of Vital Stats, and HPLO, the Health Professional Licensing Office. And we look at our general fund as well. And then we get our grand total of our special fund and general fund. So as you can see in the salaries category, we have a grand total of 9,982,250. We add on the benefits is 3,946,522. So our total personnel costs, which is the bulk of our expenditures, is 13,967,405. That's the salaries plus the fringe benefits added on. Contractual ranks the second highest at 14,534,268. And as you can see, everything has been clearly delineated on the screen. And moving on to the last slide, we can see that the total operations, specifically for the total special funds, which is all our revolving fund and our Healthy Futures fund of 972,180. And if you look at the general fund, grand total operations is 29,765,977, giving us a grand total for the special fund and the general fund of 30,738,157. And so, having said that, if you add all those previous slides all together for the total special fund, which is all the environmental health revolving fund, the sanitary inspection revolving fund, the Office of Vital Statistics fund, the HPLO special revenue fund, and the Healthy Futures funds, we have a grand total of 11,061,845. And when you look at to the right, our general fund grand total is 34,638,347. And so combining these two columns, we have a grand total of 45,700,192. And I'm happy to say that of the 45,700,192 that is requested, the breakdown contributing to this funding are as follows. 42%, the bulk of our expenditures, as no surprise to you, comes from the Division of Public Welfare. And 21% comes from the Division of Public Health. 22% comes from the Division of Senior Citizens. 10% from the General Administration, and of course 5% from the Division of Environmental Health. And of the 45,700,192, we see that we have 34, we have here the 34,638,347 requested from the general fund, and 11,061,845 requested from the special fund. So again, the breakdown for each division is there on this slide. As you can see, to the left, we have the general fund of general administration of 4,819,647, And as I mentioned, $3,387,268 from that general fund, and the $1,432,379 from the Healthy Futures funds. That's how we totaled that $4,819,647. You look now at the environmental health total, it amounts to $2,500,910 for the Division of Environmental Health, and $1,092,915 is from the Healthy Futures funds, and $1,322,570 is from the Environmental Health Special Fund. And then we have the $85,425, as you can see on the screen, that comes from the Division of Environmental Health Sanitary Inspection Revolving Fund. And that's how you get the total amount of $2,500,910. You now look at the Division of Public Health, you have a grand total of $8,893,674. But this does not include the $750,000 for the medicinal marijuana. And so this amount is taken from $1,965,118 from the general fund, and $6,928,556 in the special funds. Now, off the $6,928,556, as I mentioned earlier, $6,401,029 is requested from the Healthy Futures funds. $286,085, as you can see on the screen, is from the Health Professional Licensing Office Revolving Fund, and $241,442 is from the Office of Vital Statistics. And that's how you got that $8.8 million. Moving on, we requested $13,032,173 from the Division of Senior Citizens, and of that amount, $9,941,251 is from the general fund, and $3,090,922 from the federal share. And finally, the Division of Public Welfare has a grand total of $55,835,702, and $19,344,710 is requested, of course, from the general fund, $200,000 from the Healthy Futures funds, and $36,290,992 for the federal share. Next slide, please. Hence, we have a total of $85,082,106 as the total funds needed, of which $34,638,347 is requested from the general fund, and of course the special fund $11,061,845, and that is the combination of the special revenue revolving fund of $1,935,522 and the Healthy Futures funds of $9,126,323. So that's how we got the $11,061,845. And so you combine the local fund, general, and the special fund, and as you can see, the general fund of $34,638,347 plus the $11,061,845, you get the $45,700,192. And again, as you can see on the screen, that combined with the federal fund of $39,381,914 gives us a grand total of $85,082,106. Next slide, please. So, the above general fund request also supports a grand total of 33 FTEs. And I've itemized every single division within the Department of Public Health. As you can see up in the screen, the General Administration Office, we have 3 unclassified and 4 classified, giving a total of 7. Environmental Health has no positions there. Public Health, we only have 0 unclassified and 5 classified, giving a grand total of 5. Senior citizens will be greatly supported through the local funding. We have 3 unclassified, 18 classified, grand total of 21. None for public welfare. As you know, they have a lot of federal funds. And so the grand total, as you can see, for those that are under general fund staffing, amounts to an unclassified amount of 6 staff. However, the classified, 27 staff, and that gives you a grand total of 33. We look at the special fund, as you can see on the screen, that is also inclusive of all the 5 divisions, clearly specified as far as what's up there in the special funding. In the special funding, as you can see, we have 11 for the unclassified and 131 for the classified, giving a grand total of 142. And if you look at the screen, the bulk of these staffing comes from public health. The Division of Public Health has 9 unclassified and 82 classified, amounting to 91. So that's where most of it is going to be derived from. And specifically, I've broken it down into the different programs within the Division of Public Health. And so moving on, next slide, please. We have, if you look at everything as a whole, the general fund staff for the General Administration Division, we have 5, and 9 for public health, 3 for senior citizens, and that gives us a grand total of 17 for the general fund. For the special fund staff, for the General Administration Division of our department, 25, environmental health 28, public health 87, senior citizens 18, giving us a special fund staffing of 158. So as a whole, we have 30 staff that will be funded through the General Administration Division of Public Health, 28 from our environmental health, 96 from public health, 21 from senior citizens, and none from public welfare, thus giving us a grand total of 175 staff. Thank you.
Thank you, Ms. DeNorsi. I have a few questions for you. Does your department have any outstanding retro employee salary payment as a result of the Competitive Wage Act of 2014?
The Competitive Wage Act, we do have staffing that have gone through a series of all their personnel action being modified. That started in 2014. So yes, we do have that listing. That listing just came out previously, and more than 50 have been affected by it. So yes, sir, we do have that. We have the information that came directly from the Department of Administration.
All right. If so, what is the status of these payments when Public Law 36-35 authorized departments to liquidate any such obligation?
The obligations are there, yes, sir. It has been
Liquidated. Why isn't it being paid off already? Is there an issue?
Why hasn't it been liquidated? We just got the information not too long ago. So our department is looking into what funds we can utilize in terms of paying that. That just came out not too long ago. We were surprised because that was not allocated into our budget previously. That happened since 2014, and I did bring it to the attention of the governor. I did indicate that. And so I believe that we're trying to identify if there are additional funding to pay that, because that is going back to 2014 when some of the positions had to be reclassified. Actually, some of the positions, they changed the pay grade. And so most of them, their pay grade had been higher. And so, of course, that's more pay that has to go out. Yes.
Okay, please.
We can provide you the information on that.
Please provide the committee that information, please.
Write that down.
I would like to add that we had
If you could please state your name so we know.
Tommy Taitugui,
All right.
Administrative Services Officer. I would like to add that we have had processed personnel action requests to adjust them to the appropriate levels. So it's not that we just didn't do it. It's as their salary increments came and their performance evaluations were due, those adjustments were made to the appropriate step and grade. So, and I can't answer for the outcome of whether or not they were reclassified and to the appropriate level. That's more of a question for a personnel officer.
All right. We just needed to get the information because I've been getting, I don't know how many calls my colleagues get, but I get from every agency
Yes, sir.
of folks that are not up to date. And all I wanted to ask was that simple question. If you got them,
Yes,
list
sir.
them. If you're trying to find a source of funding, as you
Yes,
look
sir.
for it, please provide the committee the report so that we know what's outstanding out there.
Yes,
So
sir.
we can make all the employees whole and be done with it. All right?
Absolutely. I couldn't agree more. We're going to give that information to you.
Thank you.
Yes, sir.
The department has, what's the department's plan in filling vacant positions from FY 2020? You have about $3 million there. is there a movement to get them filled, or?
Yes, of course. We want to fill all the positions as much as we can.
Okay, what's this, do you have a timetable? You know, the clock is running out already for 2020, and I know that the COVID, and you're busy. I know that for a fact. You are busy.
Yes, sir.
But I know you need to fill the position. I'm just concerned is that, you know, Mr. Tadinko, right, is the last name? Tidegui.
Yes,
Mr.
sir.
Tidegui. I just want to make sure that the movement is moved, you know, to get the positions filled, because at the end of the day, I just don't want to be able to hear that public health can't do it because they don't have people, you got vacancies. Do what you need to do.
Yes, we're doing it already,
Okay.
and we're continuing to have those positions that are not COVID-related as well recruited.
All
That
right.
I assure you.
Okay, you were budgeted 106,548 for 6 facilities for typhoon insurance. Are you still at that same buildings?
No,
Ye-
sir.
Okay.
We of course, you know, Manila is no longer there,
Yes.
so that's one of the buildings that are not in there, but we did insure the others. Tommy will talk about that.
Yeah, along with Manila, we have other facilities that we have under that coverage. Now, it was to the best interest of the government to continue the insurance coverage for the Manila facility, only because we do still have some assets in there. And should there, you know, be a storm or whatever, if we have to file a claim against it, then we're prepared.
And currently, we have already looked into also the power issue, so we requested for the power to also be cut.
All right, thank you.
Save more money.
Do you have insurance to the Manila building at all right now?
Yes.
Or no? Okay, so you guys be working out whatever you need to work out for the insurance, okay?
Yes, sir.
And if you intend to demolish it, or you guys decide whatever you need to do. I know for a fact that I think there's 3 or 4 of your offices in the same building where I'm at, so I know where your folks
Yes,
are
we
at.
love your building.
I'm sharing space with you on the same
Yes, sir.
building in Timuning, okay?
Yes, sir.
Okay, office supplies. You know, what I'm going to be asking you a question is what we see in the budget, okay? You have copy machine. Are the replacement of toners included in the lease? You have you have copy machines and stuff like that. Is that all part of the loan, or did you buy the equipment, the printers and stuff? I'm just curious.
A lot of our copiers are leased.
Okay.
So we lease our copiers through GSA, of course.
All right. Okay.
Yeah, because they always
Okay.
break down, so it's better to lease them.
Are the Medicaid payments claimed by GMH Guam Memorial current? Medicaid payments, are we up to date or
So
close?
far, from what I've heard, I mean, I've been giving an update with the governor. They've been up to date, and we've been giving out information and processing as quickly as we can. I know
Yes.
there's still MIP claims that are coming out. That is still ongoing, but the payments have been made most recently. I know that for a fact because we did a payment not too long ago.
All right.
And if you want the nitty-gritty nuts and bolts, I have my guru, Tess Archangel, outside that would be more than happy to answer those specific questions.
Okay. You're asking in your budget 1.2 million for foster care group home in 2021.
Yes, sir.
Is this another foster care as compared to FY 2020, or is it pretty much the same thing, but because of the rise in cost, the amount has shifted from 864 to 1.2 million?
My understanding is that it's increased due to, like, not only are they going to outsource the services to run the facility, but also to acquire local funded positions. Most of that Bureau of Social Services Administration, they're all federal funded positions. So with regard to our local foster care home, because it's a local effort, it was only right to provide them, to acquire or recruit individuals.
Yes.
All right.
Facilitate.
Yeah, but in your regards to your question about the health insurance, it may remain stable. Last year was 700,000. This year it's still 700,000. So there was no change on that. In regards to Our total operations is 5,532,177 as of 2021. 2020, it was less. It was 4,845,230, which means there was a difference of 686,947, which is higher this year. compared to-
Ms. DeNorsi, are we talking about the foster group, care group?
Yes, sir.
Okay,
That's what I'm talking about.
okay.
Yes.
I just want to make sure.
Yes, and of that, the bulk of that is the 3,051,518, and that's for the contractual services, and that's going to include the Gumaminaasi. The building that we currently are using, because of the COVID situation, we're making that as our, our facility for testing and
All
acute
right.
care services. But once this is done, we're going to revert it as soon as we get the invitation for bid completed by the Attorney General and got that all down packed. We're going to revert it to what it's meant to be used, which is the Gumaminaasi, the foster care home.
All right. If you can answer a simple question, COVID-19 federal assistance, how
Yes,
much
sir.
did you receive in 2020 and how much was extended to 2021? And that'll be
Yes.
my last question.
No problem. I do have a whole listing of that.
Just the total amount. You don't need to break it down in each, just the total
Yes, sir.
amount.
Okay. The total amount for the CARES Act, we have 17,113,912. And then we also had the special awards funds of 710,330. We also had other COVID awards of 4,869,796.20. So that gives us a grand total of 22,694,038.20.
All right. Thank you, Ms. DeNorsi. I'd ask now
Yes,
the
sir.
oversight chair to ask question. I asked my colleagues, reminded that we will be ending this budget hearing at 11 o'clock. We have another public hearing. Senator Therese Terlai.
Thank you very much, Mr. Chair. Thank you very much, Director and Mr. Taitagui, for your presence here and of course your work throughout this pandemic and the health emergency. We know that public health is the public health authority throughout this, and so that you have had a tremendous workload. So I want to thank you and all of the employees of the Department of Public Health. In the interest of time, I'll just get straight to my questions. Can you just please explain for everyone overall? So we are looking at the governor's budget request, which was submitted in February, and then we have a request from Public Health that was submitted in I think March or April, and then of course we had the public health emergency.
Yes.
So can you please explain whether the FY21 bill that we're looking at that was submitted by the governor takes care of the needs of public health through FY21 in light of the public health emergency?
Yes, in regards to what we requested, as I mentioned earlier, we requested from the general fund of 34,638,347, and our ceiling was 26,042,524. So there's a difference of that 8.5 million, 8,595,823. We took that and we added that with the Medicaid administration costs of 2,003,574, and also for the Medicaid payment of 9,992,421. So that gave us a grand total of 20,591,818, and so that was what we were also provided for the Medicaid. And so that we have been assured that we have. And I confirmed that also with the governor yesterday.
When you say you have it, you mean will
We're
be
going to be, it's in the budget, yeah.
in the request?
Yeah. Yes.
All right, so you're asking for more than the governor's original submission,
Yes.
correct?
She's-
All right,
she's-
yeah, that's my reading
Yes.
of this also. And so,
It's actually in the local match Medicaid program. That's where it's
yes.
under.
So
Yes.
those
Yes,
numbers
ma'am.
have changed. Okay, so I just want to note that. And then, and what about and then you've received COVID federal funds.
Yes,
so
ma'am.
does that take care of the needs of the department going forward or
Yes.
because I don't think your budget when it was created had the needs to respond to this health emergency.
You
all
asked us in the last budget hearing, I don't know if you remember, for us to provide you
The oversight? Mhm.
Yeah, the last oversight hearing in May, you asked us to prepare a budget for you.
Yes.
That would give us an understanding of the CARES Act.
Right.
So we did. We have that, and I'd be more than happy to share
All right.
that with you. And I did run it also with the governor in that regards. And so we have about, I have it specifically here, a little bit over 3 million, in addition to the 331,000 that was for the testing of the COVID. Remember, ours was
Yes.
the smallest amount.
Yes.
And so you asked me to go back and look at all the positions that we can add on, and also other supplies and equipment that we could also assist the community with, if you recall. And so
Yes.
we did that. We did as you requested, and we have it on our thumb drive. We'll be more than happy to share that with you right here. So when we looked at that, I also attached all the positions for you. And so we're looking at just the salaries alone of $1,461,763. And that salaries will be taking care of a grand total of about 41 individuals, in that regards. And then we also included the overtime of 101,199 and the hazardous pay of 16,866. So the total salaries is 1,579,828. And of course, when you add that with the benefits of 737,072, that totals to the salaries and benefits of 2,316,901. The contractual, we also gave you a whole
Oh,
listing
Director,
of that.
yes, but I just wanted to be assured, those will all be covered by federal funding sources?
Yes.
Okay.
No, this one is CARES Act. So this
All
is the
right.
one that's going to the governor. That
Okay.
will be funded through
Oh,
that.
okay, so that's the
Yes. That's the one-
allocation that was not allocated before?
Correct.
All right,
That's
great.
the one you asked me, remember?
Okay,
Way back in.
and so what about, let's talk about the division of, by the way, so the chair has invited you to give to his staff anything that you would like us to get copies of? They would be able to?
Yes, we provided everything,
thumb drive?
actually, that we are overflowing with all these PowerPoints, and you all said it's too much, so we'd be
Oh.
more than happy to provide you everything
All
that we
right,
have.
appreciate it.
So, not a
Thank you.
problem.
Okay, so, so going forward, again, in the interest of time, I just want to concentrate on the, we're trying to open up tourism, we're trying to open up everything in the government and private sector, but it was supposed to be predicated on the ability to swiftly test and investigate and trace and, stop the spread.
Yes, that's what we're doing right now.
Correct. So did you, do we have like do you believe you have the permanent capacity to do this? I thought we were going to use federal funds to, shore up the division. Or, because I heard
Yes.
on the media recently that you were going to get the National
do.
Guard and UOG personnel to assist.
Yes,
So,
yes, we have the plan. Our plan is ready. We do have extra funding. As I mentioned, the funding that I just shared is part of that. We have the epidemiology laboratory capacity enhancing detection.
So we
also-
haven't done it yet. You're waiting for the funds to come in. Is that what you're saying? To make it a permanent type of
Yeah, just the
improvement?
final approval of the plan on the end of the epidemiology laboratory capacity, but the funding is there already. Just
Okay.
the plan has to be approved by the feds.
By
for
the
that-
federal government?
Yes.
Okay.
But already the funding has been already
Okay, great.
allocated for the island of Guam.
So to be clear, so going forward, we will have a permanent capacity at public health to swiftly respond, like, for example, the incident that we had with the Reef Hotel Airmen, that you're going to be able to swiftly respond, that we will have enough people to trace, we will have enough people to swiftly, and I'm hoping it means within a couple days at the most,
Yes.
to lock down whatever we need to make sure that the public can be informed of what they need to know.
Yes, we have everything in our plan, and I'll
Okay.
be happy to share that with you as well.
All right.
That itemizes how many people for each of our branches
When do
within
you-
the
when do you-
Department of Public Health.
When do you expect that to be approved or implemented then?
Right away, actually, we have all these fundings, so we're already moving forward with the recruitments of these people. And I'd like to also share that the funding sources are coming from, as I mentioned, all these different grants
Right.
that I mentioned
Yes.
earlier. So right now, just to give you a heads up, we already have 49 nursing staff that have been recruited for our public health department. Of that 49, one is a nurse practitioner, 23 are RNs, and 6 are LPNs, and 19 are nurse aides. And we have right now 42 pending the processing already. So if we look at the 42 that's just pending, Of course, this is in addition to our current staffing, okay? I just want to make sure you comprehend that. Of the 42, we have 30 RNs that are also coming on board and 12 nurse aides. So that gives you a total nursing staff for the 49 plus 49 that are currently on board, plus the 42 that is pending. We have 91. I do have a table with the other resources. We're going to also get the help from our 3 DOE nurses that are currently agreeing to stay on board. We're also getting assistance through the Guam National Guard. We're requesting for 26 more individuals. And as I mentioned, Senator, you asked me about contract tracing, so we make it fast. And that's one of the reasons why we're going to have that. And also for the containment branch. For the police, we're asking for 4 more. And then the Department of Labor, we already have this in motion where they're going to provide 12 community program aides and 12 data clerks for our department. So that's a grand total of 24 more people. The CDC Foundation is donating 6 individuals that they're recruiting on their end, and they're going to provide it to Guam. This is all paid for by the foundation. Guam doesn't pay for anything. And that's only for a very short duration of period, however, for about 11 months or so, and we plan to just retain them. And so we also have the Pacific Island Health Officers Association that contributed 1 microbiologist. That is a region for the entire Western, our whole US API, and she's committed to being in our laboratory, and she's there right now. And also the US CDC advisor that we just have on board. So in looking at that, that's an additional 30 more people compared to what we already have.
Dedicated to
Yes.
tracing, investigation.
Everything.
All right, thank you. I'm concerned because we're opening up, and it seems like we
Yep.
were supposed to have that all in place before we started to
That's
open
why we have
everything.
our plan.
Thank you. All right, and then the Division of Environmental Health, as we know, is in charge of, investigating and
Yes.
making sure that they are complying with public health standards, restaurants, bars, everything. And
Yes.
now we've got additional guidelines and standards that we've asked people to comply with.
Yep.
But at the last budget hearing, they stated they had a total of 80 FTEs, and they needed, 80 was an ideal, and that we currently have at Division of Environmental Health, 28 FTEs. And you are requesting for an additional 3, an administrative assistant, an environmental health tech 2, and a cashier 1.
Yes.
And is there any plans to increase this division to
Yes.
meet the needs, really, of inspection?
Yes. We added several positions, and this is in the CARES Act, the
Okay.
Safe CARES Act that's going to the governor. We added, I'm going to just read them out loud. We added Environmental Public Health Officer Administration and Environmental Public Health Officer Supervisor, and Environmental Public Health Officers. We added 6 more of that public health officer.
And those will be in place throughout FY21?
That's what this is just a request going to.
That's the request, great.
Yeah, so hopefully, if you can understand that we're taking little baby steps right now so that we can get there. We realize that, we're in a stringent type of budget, and so we're just trying to,
Yes.
the
I
reality
understand,
is there.
and I thank you for those efforts. But I think from the public side, it's critical. We
Yes.
should not be opening
Of
things that we
course.
cannot assure the public of their safety, and so that's what we're all relying on you for. So
Yes, Senator, I realize that, and I'm very supportive of that.
thank you. All right, and okay, so this recent investigation at the reef, I heard the person who was in charge, I think her name was Annette,
Yes.
on the radio the other day describing the process. And I was very surprised to hear that you don't have direct access to these personnel. You have to go through military chain of command and your own chain of command to get information. And I just wanted to know, is that the way it's going to be going forward, or have you resolved this type of, are you going to have the authority to truly investigate incidences of infection on Guam?
Of course, that is our role as the Department of Public Health, the safety of the entire island. Yes, ma'am. And realize that the military has their own protocols, Guam has their own protocols. We have to work hand in hand with each other, as you know that. We've been working very well with Rear Admiral Manoni, as you know. He's been appearing in several hearings along with the governor and myself, notifying the public. Our staff have already launched all the investigation in regards to those cases with the Anderson Air Force Base. We've already tested pretty much outside of just the 127 individuals have already been tested through the military area. And so they have already launched that. And of that, 35 have been confirmed on the military side and 2 healthcare workers on their side. And then on our side, we also launched testing for all the employees at the Guam Reef Hotel, which was about close to 77 or so. And of that, 1 was positive for the coronavirus. And the other one was positive just the other day. Remember, there were 2 positives. The other one was positive because of the quarantine. This is a travel-related that ended up becoming positive. So we got that from the quarantine site.
All right.
So that was very well contained, as you know. And we did adjust all our protocols, modified it so that we can think of things that we never thought about in the past, like emergency situations, which we never thought about that. We also looked at other residents, non-residents, also hotspots that are occurring. And as you know, those hotspots, whether you're resident or non-resident, you're going to be quarantined in the Government of Guam quarantine site. And then we also assess essential workers. And of course, the military buildup is very critical for our island. And so we have worked hand in hand with the different contractors in the island to ensure that the H-2 workers coming into Guam are safe and that they have certain construction workers have really, really wonderful barracks that they do have isolation and quarantine facilities. And they also hire their own nursing staff to assess all those H-2 workers coming in. So we've also collaborated with all these individuals. And so having that plan in place, the protocol that we issued out was modified to include all these things that we never anticipated in the past.
All right, well, I appreciate the changes that are being made because, yes, we're talking about opening up more visitors to come in and we need to be ahead of the game.
Yes.
But, Director, it's been 7 days since we first found out one of the airmen had the COVID. Then we've only found out today in the news potential establishments that they might have gone to. And I feel like that's maybe it's 10 days. And is that what we should expect, a 10-day response to even know where they've been as opposed to, something quicker? And we should know immediately
Yes.
what our potential exposure has been.
Well, a little part of the delay, Senator, is because the military was doing their own contact tracing as well. And so they had these individuals under their wing. And so that was pretty much, and then we came in when we first found out about the first positive case. And that was when we intervened, when we had the call, and then we had to, actually we had to take aggressive measures, and we did. We made that phone call to the military. I was part of that call. We communicated with Captain Vega, and we assessed, and we clearly did what we can to get more information. And we also asked permission so that we can get our team out there to start the investigation, and we did do that. Today, I will be issuing out a press conference on those establishments and what we're going to say as far as for the safety of everyone, that those who visited any of these establishments, that we're offering them testing as well. So that press release will come out today.
All right. Well, my concern is the hoops that you have to jump through, right? I feel like those should be abolished now that we know that they exist and that you should have the authority that you need to investigate. The public should hear about the results prior to 10 days later. That's too late. Our visitors will be gone by the time we,
Yes.
find out whether infection has spread.
Yeah. The military, like I said, the duration also is that they assured us that they did have testing every day, health screening. And that's the time when they realized that they were close to the ending of their period of the incubation, and that's when they found out. So I agree with you, Senator. We're taking as proactive approach as we can.
I hope you can assure the public going forward that, we will have answers within, 24 hours.
I don't think I've
something
been
like that.
reluctant to release any information. I'll be honest with you. I'm one of the people that, all the radio stations constantly contact me. All the different entities contact us. We're always having staff on the radio. We're having staff, provide information to the public. We've been at least every day you get test results.
Sure,
Every
I
day you
understand
have
that,
that
Director.
advertised.
However, we're being told now that we have to wait till we get permission to, get this thing done, that thing done. We have to wait, until we get access. We have to wait. We've waited 10 days to know which establishments they went to, and I just think that's too long. So, yeah, I know that you are concerned about this, so I'm hoping, from the very upper levels, we get this settled. And
Yes, ma'am.
It's just not satisfactory. Thank you, Mr. Chair.
Thank you, Senator Therese. Simple question to you, Ms. DeNorsi. Rule of thumb, you arrive on Guam, you get checked, right?
Yes,
And what
sir.
happens after that if you're checked? What is the rule? Because it's quite obvious it's not happening on base. I'm a retired, and I don't appreciate if the military does that. I like to know what is the rule on Guam, because it doesn't matter if you're in the gate or outside the gate, there's only one rule. So what is the rule?
Well, if you're traveling, my protocols are very clear. You have to fill out a health declaration form before arriving, before that plane lands. We have that already with all our airline industry. And they check the box if they're having any symptoms. Where are they coming from? Where did they originate from? And from there, that's our first cue to also indicate where are they physically staying, so we can trace them and do what we have to do. And then, of course, as they journey through the airport, they are tested again. They have the screening right at the airport. Our staff are there to do that. We also have the staff physically there. I just deputized 10 more government of Guam entities to assist because of the high volume of travelers coming in. So we smoothen up the line and we don't get anybody upset for waiting so long through immigration and all that. Once our nurses identify if you are indeed with symptoms, they put you on the side, and then we continue identifying if, where are you coming from, and then answering a series of questions and so forth. And then once that is known, they will be tested, of course, if they have symptoms. If they don't have any symptoms, and if they're coming from hot zones, they'll be automatically going to the QFAC. If any military does not have, and we had the discussions also with the military, if any of them are not with any letter of approval, if they're a contracted worker or not, and they just don't know where they're going automatically to the QFAC now. And that's a big change that we discussed with the military to ensure that this doesn't, this is in place. Also, if they're in the QFAC, we continue to monitor them for 14 days. They are not to leave. They are in strict quarantine with, of course, the National Guard being there to make certain they don't escape or they don't go anywhere. They're strictly done. And as you know, we've been very successful in our quarantine and isolation facilities, and that continues to occur as we speak today. Then what happens if anybody who is in the quarantine during the incubation period, if they end up becoming sick or what have you, they're also screened as they are there 2 times a day. And so if they have symptoms, then we most likely will also test them. And if they test positive, then they're moved from the Government of Guam quarantine facility into the Government of Guam isolation. For those that are residents and they're not coming from hot spots, then we will let them do home quarantine. Again, the requirements are very stringent. There's restriction of movement. They're to stay there. They're not to travel, only, if they need to get food, and that's it, and no other area to go. If they become, again, during their home quarantine, we also have our IMOCA app that allows us to communicate with them, and they dial in through a device, a smartphone, and they monitor the symptoms they have, and they also provide a video to us at the department that we receive this video, and our staff are there to also provide information to them and communicate with them. Also, they're getting calls every day, twice a day, to assess how they're doing. We also do spot checks, so we want to make sure that they're adhering to their quarantine or their isolation at home. And so our staff will physically go out there and check if they're home. And they will just come out and present themselves, and then we'll know that they're there. So that's what we're doing.
All right. Thank you, Ms. DeNarcy. Senator, you want one? Okay, Senator Therese, one follow-up.
Thank you. Director, could you please just discuss the Medicaid and MIP between FY20 and FY21? So that, does your request for FY21 sufficiently cover your needs for Medicaid and MIP going forward? And we're talking about, well, I guess we should say the governor's request, because that's what's in the bill before us.
Could you answer that with a
Yeah.
yes, ma'am?
Well, what we're saying is in the MIP, I'm just looking at our request here. We requested for MIP, you're asking for the difference, right? So I have that information.
Yeah, is there a difference between what you've requested and what the governor has submitted? Same? And does that cover your needs going forward for FY21?
For MIP, yeah.
Yes?
Yes,
Still, yes?
yes.
All right.
All right, thank you.
All right. Thank you. Yes.
Senator Regine Bezcoli, you have any questions, ma'am? And you'll be followed by Senator Mary Torres, and then we walk down the aisle for all the other senators. Thank you.
Suzus Masi, Mr. Chair, and thank you very much, Director DeNarcy, for joining us this morning. You mentioned that funding was already received for COVID response resources to include the contact tracing and increased testing. But I wanted to ask, when was the COVID response plan submitted to the feds for approval? You said it's still pending approval from the feds.
That was submitted just last week because that's what they require. And so we're hoping to hear very shortly.
Okay, I
That's
asked
the
because
big one, the 5.6 million. Yeah.
I
That's
see.
to fund 26 positions.
I ask because I remain really concerned, obviously, for our health and safety, especially, you know, as the oversight chair had mentioned, we reopen. We look forward to opening
Yes.
up our island to visitors in the coming weeks. And I also share the concerns of the chair regarding the delay in the contact tracing and getting this information out to the public as soon as possible. And I agree with you that you have been on the radio, but that doesn't negate the fact that it's been over 10 days from the incident, and we don't know where these people have been in our community, and it's really worrisome for many of the people who are out there, all the employees that are now, working in Tumon and going home to their families. And so we have a better understanding of how this spreads, and we just need to be on it, more on it than we have been. And, ensure that the public can have some sense of, that they're relying on us, and we know that they're relying on us. And so I just want to emphasize that I'm very, very concerned about that. You mentioned something about the Mangilao facility, the unusable Mangilao facility. Does your FY21 budget request fund any permanent solutions to the divisions, programs, and offices that are temporarily housed all around the island?
Yes, it's part of our funding already.
Can you indicate?
We fund it, we put it in our budget, yes. The office space.
Yes, office space for the individual offices, correct?
Yes, that
But
is
does your FY21 budget request fund any permanent solutions to the divisions that are all temporarily housed around the island?
In terms of permanent, are you talking acquisition of facilities? Or
I just want to know what your plan is going forward, because I understand that all these divisions kind of been spread out to whatever was available.
Yeah, one of our plan is we're going to build a new building, which is the healthcare building. Actually, it's for the Division of Environmental Health, which is a $3 million Department of Interior. And that's specifically for environmental health administration.
Okay.
We're just waiting. We did all the clearances already throughout the entire government. We did all that from the State Preservation Officer. We did it with the Department of Agriculture and so forth. And we're just waiting for them to respond.
Okay.
And we've been continuously following it up. And that will be just adjacent to the existing environmental health laboratory, and right across is the Northern Region Community Center. So that property there, that's where we're planning. The other plan that we have already
Sorry,
in
Linda,
motion.
what village is that in?
Dedido.
In Dedido, okay.
Yeah, right across Weddingdale. The other plan we have already in motion that we've been communicating really well with the US CDC is to build a modular laboratory. And that also, we're just waiting for the funding to be received. We provided the price quotes already, and we send that already to the federal government, and we're just waiting for all the little nitty-gritty details, like what type of equipments are going to be in each of them. It's like a modular facility, and so that we're just waiting for. So that's another $3 million project for the laboratory.
Thank you very much. How well does this budget request fund the department's responsibilities for medical and adult use cannabis? Will you be able to afford all of your regulatory activities?
Of course, you need more staff with environment. When you say regulatory, the first thing come to my mind, of course, is environmental health. You know, looking at all the restaurants, we never have enough, no matter what. Also, the other entity is, of course, the daycare centers. We want to make sure that these facilities are adequate and safe, and so those fundings are also considered. We have a good take on the daycare, and so in regards to environmental health, that's the reason why we added more positions to make it a lot better as we speak right now. And we're also funding and moving forward with those positions that are already in the budget.
So are there positions that are specific to medical and adult use cannabis?
Oh, yes. In fact, I'm glad you asked about that, because I already completed with Sid, my staff. We finished our medical cannabis. We hired already a PC4, so she's been on board. And then the other positions we're still recruiting, and we started that way back. And so we're following it up again. You know, with all this COVID coming in, it kind of put it in the back burner. However, we also submitted our RFP for the seed-to-sale software. So it's right here that we worked super duper hard on.
All right.
And it's just ready for approval from the AG. We submitted it to the AG on March 20th, and we're still waiting. So it's already done. If somebody would tell me it's all good, I'm going to put it out and announce it, and then get some RFP quotes, and we're good to go.
That's great news. Thank you very much, Director Linda. One last question, Mr. Chair. There are more major increases for other contracts, more than $1 million in the program and the transportation services
Yes,
contract.
that is
I know
correct.
you mentioned that.
Yes.
Can you detail why GovGuam needs to increase this investment to the tune of more than $2.6 million across these two programs?
Yes, these programs are very critical because, as you know, as you've seen through what we've done with passing of the meals, I continue to shake my head and say, how come every time we feed them, it keeps going up and up and up, you know? I think when you feed a certain number of people, it stays stationary, right? So throughout this COVID, we had to change the contract too. And one of the reasons why we put an increase in it is because we wanted to have an impetus for people to come and help us with the food. And there was a little minor increase in the pricing, and that's why the cost went up, and that's why the contract had to be modified. And it's just a way so that we can get more people to help and assist. And that was pretty much the reason.
Right.
We're still uncertain if that will go back down or not. In this budget, we just did an overall of what we can afford. And as you can see, the C1, the congregate meals, and the C2, we also requested for the overmatch. As you see in our budget, for the C1 congregate, we have a total of 909,967. And when you look at the delivered meals, it's 845,000. So again, it's because the pricing changed in regards to the meal cost. Yeah.
Well, Linda, I will just say that I've been really impressed with the way that your team has responded to many inquiries from our office, from environmental health to BOSA and CPS, and all the times that we reach out to you to get to ask questions, and you know the answers are always. You're very forthcoming with all, and you're very transparent, and I appreciate that. So I want to thank you and give kudos to you and to your team for being open and responsive to our inquiries, and we hope that we can continue to have that kind of dialogue. And like the Oversight Chair said, We know that you're at the forefront, leading the charge for our island against this COVID pandemic, and we appreciate all the work that you do. I know it must have taken a toll on you and your staff and all of the families that are affected, but I want to say that we really appreciate the work that you do, and we're going to continue to push you so that we can just continue to do better. So thank you very much.
Thank you,
Mr.
Senator.
Chair.
Thank you, Senator Lee. Senator Mary Torres, and you'll be followed by Senator Moylan, and then we're just going to continue down the room.
Thank you, Mr. Narcy. The question that I had that the Oversight Chair brought up was regarding MIP. In your presentation, you showed a variance of between the fiscal year 2020 and 2021 as about $4 million being underfunded in 2020. I just wanted to confirm, because you said that going forward, you believe that you've made all considerations for the COVID-related situation right now, and knowing the number of people that are unemployed and most likely uninsured, you're still sure that this miscellaneous category about 35 million or 34.5 million will be enough to cover MIP?
If you mind, I would like to call Tess in. She's the guru of Medicaid and MIP. Is that okay? So we can give you a great answer.
If she can, if
Yeah,
not,
she's right outside.
Yeah,
We're
I'll
calling her in.
defer, because I think what we're all concerned about is the effect that it'll have not only on public health, but
Sure.
also on GMH if they
Yeah.
go to GMH as a
So,
source of health care.
Hi, Senators. Good morning. My name is Teresa Archangel. Okay. Can you repeat your questions, please?
Hi, Ms. Archangel. Good morning.
Good morning.
I was just noting that in the budget variance where you listed under miscellaneous, a notation, a justification that about $4 million is due to MIP being underfunded in 2020. And
Yes.
so the question that I had to Mr. Norcy is, you're saying that the budget submission is adequate to cover COVID-related needs right now and the situation, but I was just asking, are you comfortable that the amount that you put in for the budget will be adequate to cover also MIP, given the fact that so many are unemployed, most likely uninsured, and will be relying on public health and maybe GMH for care? You put in a variance of almost $4 million. Is that, so now it becomes $34,600,000 for MIP?
Yes, that's true. Because the funding that was given to us in FY 2020 is really very low. I mean, because of the transfer authority of the governor, we were able to cover a lot of services for MIP. But one thing to keep in mind is that MIP emergency services, which are inpatient services for GMH, for off-island inpatient services, for ER services, for delivery services, for hemodialysis, all those expenditures of MIP can be charged to Medicaid. Yeah, and for fiscal year 2021, we will be given $127 million for Medicaid.
Okay.
Yeah.
All right, that's good. I was hoping to get that kind of answer, because that's what we most worry about, is
Yes.
whether we can sufficiently provide care when people go to GMH or things. So yes, thank you for that clarification.
Excuse
You're
me,
welcome.
Senator Torres. Ms. DeNorcy, there's only 2 of you allowed in here. If anybody else is going to be added on, they have to be sworn in by the sergeant arm. Okay, I'll have the sergeant arm swear her in, but there'll be no one else added. You would be the only one testifying, or ASO. Sergeant arm, please have her sworn in. And then you may continue, Senator Torres, after that. Thank you, Sergeant Arms. Senator Torres, please continue, but that'll be the last one added on. Okay, Ms. DeNorcy? Thank you.
Well, Mr. Chairman, that was my only question, and in the interest of time, I don't have any further questions about MIP, but I'm glad that a lot of it, the charges can be billed to Medicaid, which is what I was concerned about, whether the impact to the government's funds were going to be adverse. But in this case, I think that you contemplated that, and that's a good thing. So just for clarification, thank you very much. No further questions.
Senator Moylan, do you have any questions, sir?
Thank you, Mr. Chairman. Thank you, Director, and your staff. Director, you mentioned 2 deputy director positions. So I was just trying to figure out.
Yes, that is correct.
Thank you. I was just trying to figure out on the organizational chart, I see one position. Where would the other deputy's position?
Yes, one is going to be for public health and the other one's for social services.
So, and you have a staff of 175
Yes, sir.
personnel? And is the majority, you said, of that 175 under social services? Which deputy handles more people?
Yeah, I had the slide up there, and I thought that was clear, but not a problem. I will address it. If they want to put back the slide.
Oh, it's all
happy.
right. So it's in there?
It's in there, yes.
I didn't catch it?
Yes, yes.
Okay.
And that has a breakdown for each of the divisions.
All right.
But if you want me to answer it, I'll be more than happy to answer it. I'm going to just pull out
Oh.
my slideshow again.
I'll find
And
the slide.
I'll get it.
No
Not a
problem.
I have it right
Okay.
here. For that, the majority, as I mentioned, was for public health, the Division of Public Health. And majority would be 87 for the special fund. And then that will be followed by environmental health at 28 under the special fund. So as a whole, with all the special fund and the general fund, of the 175, 96 will be for public health, 30 for the general administration and the division of our, general administration, and then followed by the environmental health division, and then the senior citizens of 21.
So one deputy director takes care of a certain division.
Social
another-
services, and
social
the other one takes care of public health. Yes,
and
that is
public
correct.
health. Was this common, the 2 deputy director positions, or is this a new?
Because we have a long-term plan.
Okay. When did the second deputy director come on board?
She came on board right about close to March, somewhere around there.
March this year?
I'll have to go back and look at the exact date.
Or this year? Sorry.
Yes, that is correct. There's a plan within our department, contingency plan, and you'll find out about it soon enough.
Looking forward to the debut.
Thank you.
Thank you. The Manila structure, you discussed that, and you also discussed constructing a new facility, and that you went through all the process, and you're just now, we're awaiting, I guess, the approval from government agencies. In the meantime, the Manila structure, you're renting other places.
Yes, sir.
And in the meantime, the Manila structure, can it not be just refitted? It was a room that was burnt, but is the whole interior burnt?
Yeah, I'm happy to speak about that. That was the fire. According to the fire department, the whole facility is not habitable. The electrical wirings, there's overload in the electrical structure of the panel box. And so there were smokes coming out, there were fire burning at the receptacles and also the balusters. And so when they came, they were saying you were very fortunate that the building didn't blow up. So I cannot take any chance on anyone's life. So I had to follow what was advised, that it's not habitable. And so we did everything we can to move out of there as quickly as possible.
So to correct that, I was just wondering on the time frame from when this new building will be constructed and the rent you're currently paying, and then if we could temporarily fix the other building in the meantime, because it still would be your department's property, I suppose. And
Yes, it is our department's property. That is correct.
right, and if you have plans for growth, I'm wondering, could the insurance, I guess, cover some of the repairs on that? Are we going to fix that building?
The insurance, we went through Alpha Insurers and they didn't cover anything, unfortunately. And they gave us a letter saying that it's not covered at all.
is not covered for fire.
Nope, that's Alpha Insurance.
Okay, so that's why we're not moving forward in repairing the building, because it will be all out of the general fund to repair that, I suppose.
Yeah.
Okay. There was also statements about the contact tracking and
Tracing.
tracing. And I guess that's our future as we eventually
Very critical.
control.
Contact tracing, investigation, monitoring.
And you mentioned 34 other positions that are federally funded through the, this will be CARES funding or completely?
Yeah,
Or?
I have the breakdown here. We have 26 positions for the epidemiology laboratory capacity grant. We have 4 positions for the epidemiology laboratory cares grant, 1 for the supplemental for the community health centers, 6 positions for the Health Cares Act, 8 positions for the community health center expanded capacity testing grant. So a grand total of 45 more positions through the federal funds.
45.
Yes, and
New-
that
new
amounts
positions.
to $3,478,122.
And this money is
All federal.
all federal?
Yes, sir.
It's a grant, continuous grant?
Grant, yes, sir.
Congratulations.
Thank you.
And this is what the island would need
Yes,
once
sir.
we get out of our core, our positions here, and because something new will come up, and this will always be able to be activated
Yes, sir.
as we move forward. So good for that. I just want to make one statement at the end. I want you to know I went to a restaurant last night. I had with some friends, and they were really good of us coming on in, wear our masks, and we were able to remove our mask after that and clean our hands. But we also kind of gaggled. We got a bigger group than we were supposed to. So basically the restaurant said, you need to split up on 2 different tables, which I definitely complied, but I just wanted to know that, at least in this establishment, it was well received.
Yes, and we had indicated through our public health guidance memo that they need to enforce this. Otherwise, stringent measures will be taken with their licenses, that they will be revoked.
Okay, thank you, Director. I also like to see that denial letter from the insurance company too later on, please.
Yes, we can retrieve that. Not a problem.
Thank you, Director. Thank you, Mr. Chairman.
Thank you, sir.
Thank you. Senator Kelly, you have any questions, ma'am?
Sujus Masi, Mr. Chair, and thank you both for being here. And as others have mentioned, for the hard work that you're doing for the entire community, a lot weighs on your shoulders right now, and we thank you for all of that. Some of what I wanted to talk about, I'll limit it to just a couple of the questions that I have. So with the SNAP program, my understanding is that over time, sometime a while back, the SNAP Jobs program transitioned from being a mandatory requirement to a voluntary one. But my understanding is also that it was very successful. So I know you have a lot on your plate right now. But at this time, with our unemployment rates and some of what we're contending with, is there any consideration in your long-term plans or more immediate plans or any ability to have that job training program be part of SNAPs again?
It is part of SNAP. We have the Guam Employment and Training under SNAP, but it's not mandatory, it's voluntary. Unfortunately, that's the rule of FNS, of SNAP, who wants to avail of that employment and training.
Could you repeat part of that again? And I apologize, I know I'm a bit muffled. With the voluntary aspect of that, is that something that we have the ability to increase and start having as mandatory again? Or is that something that we don't have the ability to change?
And we have to federal counterpart with regards to that, but at this time it's still voluntary.
Sujus Masi, that provides us some information that we could potentially look at, because we do want to help the community as much as possible. It has been successful. I'm sure for the voluntary element that's there, it's continuing to be successful. So another question I have was about the facility. So I know that you've discussed what you're looking at, and definitely it's very commendable to have written the grants and to have those long-term plans to create those permanent facilities. We also heard the other day from the Guam Behavioral Health and Wellness Center that the governor has a plan of looking at Barragata, at that old golf range, and having a whole health campus. Is that part of your long-term planning as well as you're going forward with these permanent facilities?
Yeah, we've been discussing that actually with the governor for a while, and I think she has an envision to build a whole health facility that would be inclusive of GMH, Guam Behavioral Health, and Public Health.
And do you know at this point, it's perhaps still in flux, but how much of your facilities would be planned to be present there? You talked about
we're trying to get everybody that used to be at Central Public Health there.
Okay,
Because
good.
the other facilities, like the ones in Terlahi Building and the WIC program and the ones in Tijan, and then the Camille centers are already pretty much fit already in their areas, so.
Good. Well, and like I said, it's good to hear about these long-term plans because we need those permanent facilities, and if they can be there all together to make it convenient for the community, and then you can
Like a
perhaps
one-stop shop.
be, exactly, you can be coordinating with each other as well.
Absolutely.
So,
You're
and
right.
I noticed that was part of the transition plan's recommendation, that there be that increased interactivity between
Yes.
public health and Guam Behavioral Health and Wellness
Right.
Center.
And then the cross referrals too would be a lot easier, whether they're going to be cross referred between the social services program to public health, the healthcare arena, and vice versa, or they're going to be cross referred between public health to GMH or to behavioral health. So that's all very convenient to do if you have one building.
Excellent. And with that, so according to the transition report, has there been that increased communication and that increased interacting with each other already?
I think
with the Guam
the
Behavioral
discussions
Health?
have been started already, and as far as the envision, that's how I started. I always envision. That's how I started with the northern, and then I did the southern. So I believe the vision is still there, and I think that that will be. I can't speak and make that commitment at this point in time, but I can only say that the discussion has already begun.
Well, thank you. And I do have a few more questions, but in in trying to keep with the timeliness for this group, I'll go ahead and move on. And if there's anything outstanding at the end, I'll send the questions your way.
Thank you,
Senator
Senator.
Masi.
Thank you, Senator Kelly. Senator Louise Moniz, do you have any questions, ma'am?
Yes, thank you so much, Director, and Tess, thank you for being in here today. I could imagine that you guys are going through many sleepless nights, and we really appreciate the fact that you're here to stand up for your budget. It's very important for you and for your employees as well, too, and for the safety of our community, so thank you. Just really quickly, on Bill 282, it does show that we do have an appropriation of $20,591,818 from the general fund, and then $1,136,484 from the Healthy Futures Fund, and this is for the Medicaid matching for what we're expected to get. So I guess my questions would be in relation to this. And I guess it could be directed to Ms. Archangel. So I just want to know, like, who creates the Medicaid state plan? If we could go ahead and start with.
The Medicaid state plan is an agreement between the federal and the government. So basically, that's based on the budget. Because we cannot create a state plan that will be over the budget that's being given to us.
Okay, and so there is opportunity, right, for us to customize this plan, because we do have some Affordable Care Act that we have to pay for, that we could mandated to pay for,
Yes.
requirements, right? So is there an opportunity for, like, maybe maybe our physicians and the community physicians to take part in this development of this state plan? Is there an opportunity for that?
Yes, yes. If you can create a committee to assist on those, that's a possibility. Yeah.
Okay.
But we have to take into consideration, as always, when you're creating a committee, they should not be biased. It should be, there's no conflict with regards to what services needs to be there, not favoring anyone or any,
another.
yes,
Okay,
or
yeah,
another.
no, understood. Absolutely. I think that it should be a fair playing ground, right, for everyone. I do have a bill that hopefully achieves this, where we can include everyone in the community to help develop this state plan, because we are expecting a significant amount of money to help the community. So
That's very true. And take into consideration also that even though there's a lot of money being given by the feds, that requires local match.
Okay.
So whatever available local match, that's only what we can get.
Okay. So yeah, that's another one of the reasons why I directed my question specifically for this, because I know that throughout our budget that we have to have a local match for this. So and so then, who does approve this medical state plan? Is it
Federal government.
the federal government? So we
And
develop it and then they
yeah.
approve it. Okay.
And then we make sure we put a cost impact on any state plan amendment that needs to be done, and that we have to ensure that there's a local match that is available if we're amending the state plan.
Okay, thank you. Yeah, I just feel like that we could definitely customize it according to our specific needs here on Guam, and this would be a great opportunity for us to include everyone in the community that will benefit from it. So I really do appreciate your answers, and Director, again, thank you so much for being here. I know there are many other places that you should be, but it is important for us to hear from you directly. So thank you again, Director, and thank you, Ms. Archangel.
Thank you, Senator.
Senator Tello, do you have any questions, ma'am?
Yes, Mr. Chair. Thank you. And Hafaday, Linda, and Tess, thank you so much for being here as well. I'll get to the point. I'm trying to figure out, Linda, the budget. You submitted a budget back in January, the first budget that was submitted by you, the governor's budget, and then now you have another budget. So am I assuming, if you can just take 1 minute, this was prepared by OFB. It's been placed in front of you. Can you just take 1 minute to look at that and see if this is the same budget that you are also looking at? Because I've got 3 different budgets here and trying to figure out which one you're advocating for.
Senator Tello, what you have from Office of Finance and Budget is a abstract from the budget.
Right.
What they're presenting, there may be some differences.
Yeah.
And that's something that I
Okay.
would get with the director and the governor's office, so that when we look at the governor's request of 2021, then we make the changes as the governor's on where she's going to trim whoever, what other agency. All right?
Okay, Mr. Chair, because there is, Linda, since you're looking at that page right now, can you just go to the third page? 1, 2, 3, fourth, I'm sorry, the fourth page. The section where it says Department of Public Health Welfare, BHCFA Medicaid Assistance Program Payment. In FY 2020, it was granted $9,668,278. And this budget is only requesting for $1,136,484. That's a difference of subtracting $8 million. Can you explain this?
Yeah, that's what I explained earlier. That
Okay.
$8.5 million, when I was doing my presentation, was
Right.
already added on to the existing Medicaid amount for
Okay.
the administration of $2,000,003,574,
It was
plus the
there.
Medicaid payment of $9,992,421, and that's how we ended up with the $20,591,818.
I see.
So
And
that shortfall was already included in the budget, along with the governor approving it as well.
Last year, when we had the 2020 budget and you came and spoke with us, I was really concerned because the amount that was given to MIP and the amount for Medicaid was
Right.
very low, substantially low.
Right.
So have you already, and I think we had a oversight too, you've already run out. And so have you been given any kind of money during 2020 to help pay for some of these requests for MIP?
Yep. Yes, we were able to transfer some money that because of the increase in FMAP on Medicaid, we were able to utilize some money that is earmarked for Medicaid to pay for MIP. Due to the governor's transfer authority, we were able to pay some of those MIP claims.
And what about over at the St. Dominic's? Were you able to?
We are currently paying St. Dominic's, yes.
Will you be able to do it by the end of the year, fulfill the obligation?
We are going to look within our funding and we'll ask the governor with her transfer authority to allow us to pay for those services that St. Dominic's is going to provide.
Okay, so basically you don't have the money, but you're going to ask the governor for some money, right?
First thing, within the division of public welfare, we look for some lapse money within the Medicaid program. As I've stated, because of the increased FMAP, we might have additional funding. In fact, we have not utilized some of the local funds that is appropriated for Medicaid, which we can utilize to pay for that till the end of the fiscal year. Hopefully, we're able to pay all those claims that they submitted.
Okay, I see. And the last question I have, Mr. Chair, is are there any federal funds or grants out there that you missed the opportunity or missed the deadline in order to receive in your agency?
Unfortunately, with all the federal fundings, we were able to. With Medicaid, we were only given $3.875 million. With SNAP, we're allowed to do the emergency allotment to provide 100% based on the benefit level that each household can get. And at the same time, we were able to get $6.4 million for CCDF to be able to supplement the providers for the children. That is for child care centers.
So you haven't missed any deadlines for any federal funds or grants?
We did not miss any deadlines for that, yes.
Okay, that's very good to hear. Thank you so much, Tess, and all your work. And to all the employees that are out there from Public Health, my greatest gratitude for all your hard work and during this time of crisis. Thank you so much.
Thank you, Senator Tello. Senator Amanda? And I'd like to also recognize that we were joined by Senator Sabina Parrish. Senator Amanda, you have any questions, ma'am?
Oh, thank you very much, Mr. Chair. Many of my questions were answered, and I do appreciate all the work you and the department are doing, Director DeNorcy. I have a question about the foster care health insurance request. You have requested for $700,000 for this insurance in the past year. I know that we ran out in the middle of the year, and the foster care children went back onto the CHIP health insurance. And so I want to know what the total number of foster care children are in the system right now, and if this is a sufficient amount. I know that we can't predict how many foster children will come into the system, but if you can share with us if there has been an increase recently and what we're looking at for the coming year.
It has been increasing yearly since 2015. So for this fiscal year, currently we have 333 as our estimate for this fiscal year. As you know, it's not the end of the year yet. They come and go. Yeah.
Okay. All right. Thank you very much. So this amount you feel is adequate for the next year. We won't run into the same situation as the past fiscal year where we were in the middle of the year and we saw an increased number of foster children and ran out.
That's our best estimate.
Okay. Thank you very much. I know that we are using a big chunk of the CARES Act money to give some payments to the daycares on island, and those daycares were awaiting some kind of approval from the AG for the spending plan. Can you give us an update on that spending plan and when these daycares will be seeing those payments?
Yeah. Actually, with regards to CCDF, we are continuously paying the child care providers, those that are under our program. We continuously pay them based on the enrollment, not based on the attendance. So we have actually processed 1.2 million for them. for March, April, and May. We have submitted that to Department of Administration. With regards to the additional funding, the childcare providers need to apply for it. Currently, the plan is still with the AG, and they're reviewing that. Hopefully, we can wrap it up
Yes.
within this week and be able to do with the plan.
So
However,
this is a plan that will tell them how to apply and how you will
Yes.
choose who
Yes.
is eligible.
Yes.
The daycare centers are sub-recipients of this grant, so there are stringent federal requirements that are needed. And so the AG wanted to ensure that these regulations are clearly specified to the sub-recipients, and also the reporting requirements are clearly specified for them to report.
Okay.
And so that is the reason why the AG wanted to ensure that all these measures are in place.
So
And-
what
and
is
at the
that
same
amount that will
time-
be available to the daycares from that $6 million?
it's not readily available to them. They have to apply. They have to apply for DUNS number in order to get the grant.
Okay, so what
So
is
there is
that
a
pot that
process.
they're applying for?
Yeah, we're going to send them a letter, or we're going to do an announcement on how they're going to apply for it and how they can get the grant once it's all cleared by
Okay.
AG's office.
Right.
But what is that total amount that they're all applying for? What is the total of that pot?
6.4 million.
The total pot is 6.4 million. That's
Okay.
what was given to us.
Okay, but some of that has already been given out for the C.
No.
No, that
Okay.
was just through the
No.
CCDF grant that
Okay, so
was
that's
already
totally
allocated.
separate.
Yes.
Okay.
But this CARES Act will include all those, whether or not they're also in the CCDF program with us. That will cover all the daycare centers that apply.
Okay, so we're expecting next week to see some kind of action on that plan.
Hopefully, yeah. Yeah,
Okay,
but
thank you.
It depends on how soon the providers can apply for DUNS
Right.
number and can submit their grant.
That's right. So that would be also contingent
request
on
for
their
grant.
part, not only on our part.
Okay, thank you very much. Thank you for being here again and for all of the information. This is just Masi, Mr. Chair.
Thank you, Senator.
Senator Sabina, do you have any questions, ma'am?
Yes, I do, Mr. Chair. Thank you. And thank you, Linda, and thank you, Tess, for being here, and thank you for all your resiliency through this very tough time. I think it started in the very beginning of your tenure,
I think
one thing
since
after another.
Day one after another, right? Yeah.
Yeah, so just a couple more questions. I know a lot of the questions are asked and answered. Regarding CARES Act, do you find that it will cover the additional services that DPHSS is performing, such as providing, and also providing enough PPEs, sanitizing equipment, and barriers for the public and the employees?
Yes, I really believe that we have in practically all these additional budgets, actually all these grants, we've also included those PPEs, and that was clearly specified also in the CARES Act budget that we also will be giving to the governor. Yes.
Okay, great. The other thing that I want to ask is as far as consolidation of expenses when it comes to IT stuff. So, I noticed in some of the budget line items, it included subscriptions. Is there a way to consolidate that cost with other agencies, like say OTEC? I don't know if you collaborate with OTEC on this.
Yes, we have an MOA with OTEC. OTEC has been very supportive with our department. They've been really great. I think they've been at the forefront, especially when we moved and our fire and getting us all up and running. They have been, I give kudos to Frank Lujan and his team. We have an MOA with them, and we continue to provide services with them and work hand in hand. So obviously, when there is a need, we really share resources. For example, he needed help with the backing up of his system to ensure that they had good air conditioning quality to maintain their systems, and we provided them that support as well. So we're helping each other, and we're integrating our services together, and we're doing all we can to share the resources.
Okay, that's good to know. Can you describe what the New Hampshire Vital Record Information Network, what kind of work do they do? It's in one of the,
I'm sorry, I
is it
didn't
Schedule
understand.
B? Is it Schedule B and contractual?
Contractual for?
It's in Schedule B, Management Support Services. There was a line item for New Hampshire Vital Record Information Network.
New Hampshire, yes, that was for the Office of Vital Statistics to do the certificates, the birth and death certificates, and right now that has been in discussion as far as a system that they're trying to get in place. That's the New Hampshire.
So that's something you want to use for the long term?
Yes.
Okay. And the other thing is, I know there's a lot of efforts towards emergency response, but I'm also interested in knowing what your programs are for more preventative health care efforts using your community centers. Is that something that
Yes,
you're also...
absolutely. The communal centers are in the forefront for acute outpatient care services and also preventive services. They continue to see patients on a primary care service level so that they can prevent the emergency usage of the hospital and also urgent care services. So we try to make the services so that they're regular preventive maintenance services, for example, constant well baby checks, immunizations being provided to these children and the adults, and also ensuring that they have a whole realm of communicable disease control and also prevention in terms of education and collaboration with all the different government of Guam and also the public health programs that are federally funded. And so they do extended outreach clinics in these remote geographic locations like Santa Ana, Gilbreeze, Gumas, all the areas there where it's zero down and so forth, that we provide our services. Our doctors go out there, our providers go out there, and we collaborate with all the different entities within the government.
Okay, great. One of the goals that you guys, I think, had in one of your plans was for healthy eating more fresh fruits and vegetables. I know there's a program, it's a double up program for the SNAP recipients. I know this is something I brought up. I sent an email regarding that, and just wondering, are you planning to pursue that program to avail of SNAP recipients of more fresh fruits and produce?
Yes, we do. We are actually communicating with the farmers. With regards to that, we were able to get actually funding for them to use for the system. But unfortunately, we are not at this time successful in reaching out with them because they don't want, there's a lot of procedures that needs to follow. So we still have to communicate with them with regards to that.
But in line also with the Department of the Food Nutrition Services, FNS, we do have the WIC program that does a lot of outreach for farmers market. And so they've been very instrumental in getting local farmers to sell produce within, even outside of our Department of Public Health, our Northern Region Communal Center, using the vouchers from the WIC so that they can purchase local produce, fruits and vegetables. So yes, that is in place, aside from those that are eligible for the SNAP program.
And we do have our SNAP education program that we continuously teach them how to cook healthy foods and orient them on how to eat healthy. Okay. Stay healthy.
Great. Yeah, I know the Farmers Co-op, they're very interested in starting up that program. So yeah, I look forward to the success of that. So thank you. Thank you, Mr. Chair.
Thank you very much. Before I ask the Oversight Chair for a closing statement, Ms. DeNorsi, we're getting messages that July 1st, I guess they're going to open up the gates for the tourism. I'm concerned about, I don't know if the gates will be open. I'm only concerned that we maintain compliance with what I asked you earlier, okay?
Yes, sir.
I just want to make sure that you're on it because I know you got a lot of work.
I think Senator Terlai has made it very clear.
It looks good? Okay. July 1st, right, or what?
That's what you heard, so that's exactly what it's...
Okay, I just wanted to make sure that you're on board on that. And I'd like to thank you and your staff for all the hard work you do.
Yes, I say kudos to all my staff who are listening as well. They work very, very hard. And I couldn't find a better team than all these public health employees that have gone way beyond and work really long hours. And I hope that all of you really understand that this was a great ordeal that we had to endure.
Yes, and thank you. Senator Therese, for closing.
Thank you very much, Mr. Chair. Director and Ms. Archangel, I also, and Mr. Taitakui, who's outside right now, and the rest of your department, I too wanted to stress that we're kind of rushing through this budget hearing for one of the largest departments on Guam, one of the departments that really provides direct services. And so when we talk about do we need government services? Absolutely, and your department is really a shining example of getting direct services to the people of Guam. Almost anything we can think of is going through you, and you've made it look a matter of course. So maybe we're taking that for granted, and I'm not sure if all the public appreciates that. You, before you became director, the two of you, many of you in your department are shining stars in getting federal grants, in handling federal money, in ensuring that we are in compliance always, and that we get those services to the people who need them as fast as we possibly can. And so your agency has had to, take care of the vulnerable. In the middle of a pandemic, which has exacerbated every issue there is, from the shelters that you're providing, from the financial assistance that you provide, healthcare, of course. And so this department, I completely support your decision to have a second deputy, because the department is Department of Public Health and Social Services. Those two categories underneath them have divisions of environmental health, which is in charge of all regulation of health, all the health regulations, what we eat. We don't want to eat where there are cockroaches, things like that. The public, we don't want that, but we need to support you. And so when we push you more or ask you all these questions,
believe me, everybody pushed me hard.
Yes, and
I give my all, more than 100%.
That's what I want to say, and I appreciate very much your willingness to be open. There have been some trying times throughout these health emergencies where, we demand more information, we demand it faster, and I continue to do that, but I want to thank you for continuing to improve. You've made it very clear you're willing to do that, all of the department, and so
Senator,
we want to support you. We need to get this budget correct at this department, because it is the services that this department provides that's really taking care of the most vulnerable in our community. Thank you again for all your work. Thank you.
Thank you, Senator Therese. I'd like to thank my colleagues for their question, and thank you, Ms. DeNorsi, and your staff for providing us the slides and the information. The committee will conclude this budget hearing with the Department of Public Health and Social Service. Committee will continue to receive testimonies. Please address your written testimony to the Committee on General Government Operations, Appropriation, and Housing, and submit it via email to Senator Joe S. San Agustin at gmail.com. And si Jus Masi for your attendance and participating in today's hearing. And for those at home, thank you for watching. This budget hearing on Bill 282-35 LS relative to the Department of Public Health and Social Service now adjourned at 10:59. And have a nice day. And my colleagues, the next bill that would be heard would be Bill 354-35, and that will begin shortly after the MIS have reset the systems. Thank you.